Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Open enrollment. It is that time of year when you can choose doctors and healthcare plans that fit your needs. And with more than 25 locations throughout San Diego County, Scripps Health is here for you when and where you need us. Joining us to talk about open enrollment is Dr. Anil Keswani. He is the Corporate Senior Vice President and Chief Medical Officer for Ambulatory and Accountable Care at Scripps Health. Dr. Keswani, thanks so much for being with us.
Thank you, Susan.
So let's start with the basics. What is open enrollment?
That's a great question. Open enrollment is a time of year when people can either sign up for health insurance, adjust their current plan, or even cancel it. It's an important time of year because it gives you a chance to look at your plans. And if you miss that open enrollment time period, you oftentimes have to wait till the following year, unless, of course, there's a qualifying event.
And what is a qualifying event?
That's a great question. Qualifying events are things like marriages, divorces, birth of a child, loss of a loved one. It's a significant event that may be changing your family.
And if you're age 26 and then you're no longer on your parents' health insurance plan.
Yeah, that's a great point. No, that's a great qualifying event as well. Once you turn 26, you no longer oftentimes can be on your parents' plan.
So how long does open enrollment last? What are the dates?
Open enrollment depends on the type of plan that you have. For example, some people are on a plan like a Medicare Advantage plan, which is an HMO plan for Medicare-aged beneficiaries. And in those plans, open enrollment starts from October 15th to December 7th. Most people have open enrollment through their employer. In other words, it's a health plan that they pick up through their employment. And that can vary. Each employer has a little bit different time for open enrollment, and you want to check with your company's HR department to find out for sure what times that's available. Then there's another group of folks that are trying to obtain health insurance through Covered California. Covered California has a great website, and again, you can also call 1-800-SCRIPPS for a lot of information that we can guide you through.
And then once you enroll, when does that new health insurance plan take effect?
So once you enroll in a health plan, oftentimes for like Medicare Advantage, your new plan takes effect the following year, the first of the following year. So if I sign up in 2021, my plan would take into effect January 1st, 2022. Otherwise, employer plans, again, vary a little bit, but oftentimes when you sign up with a plan, there is a cutoff date of the mid-month. So if you sign up before the 15th of the month, for example, if you sign up September 14th, it could take effect on October 1st. If you sign up after the 15th of the month, oftentimes you have to wait a whole extra month before you are eligible for coverage.
So let's say you get your health insurance plan through your employer. What things should you be considering before you make changes to your health insurance plan during open enrollment?
Yeah, one of the most important things, at least in my opinion, is find out if Scripps Health is in your plan. We would love to see you here. And while we accept most plans, there are some plans that may not have Scripps Health in their network. So I would say check with your doctor's office, call 1-800-SCRIPPS, check our website. But oftentimes you can find out whether Scripps Health or your doctor is in your plan. Other things people often want to consider are the medications they take. Are the medications you're taking in the plan? Are they a covered benefit? And sometimes it's okay to have some changes in medications, but if there's something that's very particular you cannot change, you probably want to know before you select the plan. And the last thing, which is probably the hardest thing to do, is thinking about the year ahead. What are you thinking about the year ahead? Are you planning to have a baby? Are you planning to see some changes in your health? And weighing that out to understand the different benefits and options in each plan.
So if you have surgery, let's say, planned for the next year, like you have to have knee replacement surgery or heart surgery or something like that.
Yeah, having surgery is a big event. And I think some people say, hey, I really want to see that physician. My neighbor went to that physician. That was a great physician at Scripps Health. If you know the surgery is happening and you even know kind of where you want to have it or with who you want to have it, it's probably a good idea to look at that before you go through open enrollment processes.
And what about if you're on Medicare? What things should you be considering during the open enrollment period?
So Medicare as well, when you're going through open enrollment, lots of different things you want to look at. Everything we talked about before, again, understanding which physicians, your medications, those are all important. Medicare Advantage has some nuances as well. Things you will probably want to look at. What are my out-of-pocket costs? What are my deductibles? What are my co-pays? What's my co-insurance? Each of these attributes are really important to be aware of, and it gives you a better idea to understand what type of plan you're picking. Another big thing that people look at in terms of Medicare Advantage plans are their drug coverage, their medication coverage. What does a plan cover in terms of medications?
And let's say you get your health insurance through Covered California. What things should you be considering?
So if you're new to Covered California, there's different things you want to consider as well. One of the things is most people in Covered California qualify for some degree of subsidies. So you probably want to understand what your subsidy coverage is. The other thing you can do is also look at the right plan in Covered California. Scripps Health is accessible through Covered California through a few different plans. Molina is one, HealthNet, Blue Shield. So looking again at the plan that you're looking for, and then trying to figure out, is Scripps Health in that plan?
And then talk about the HMO versus the PPO. What is that?
HMO and PPOs have been around for quite a while. In essence, they're both health plans, and they're just different types of ways the health plans are structured. An HMO is a plan that you're oftentimes picking the primary care doctor in advance. And you can change that primary care doctor at any time during the year, but they're looking for you to pick a primary care doctor. And oftentimes there's a network that's predetermined, and you want to be aware of what that network is. A PPO plan is a little bit different. In essence, you're oftentimes not picking a primary care doctor in advance, although you're more than welcome to, and we encourage you to. The network oftentimes is a lot larger, and there's oftentimes a larger copay or share of cost that the patient pays.
But the HMO plan, you have to pick a primary care doctor, and then you have to always go through that doctor who would then refer you to, let's say, a specialist, let's say a heart doctor or an orthopedic surgeon. Whereas the PPO, you can just go to any doctor you want. You don't have to go through that primary care doctor. Is that correct?
Yes, so a referral through your primary care doctor is a hallmark of the HMO plan. So if I'm seeing my primary care doctor and I want to see a cardiologist, oftentimes you reach out either by phone or email, or you go in to see your primary care doctor and you ask them for a referral and you explain what you need, and they refer you to that cardiologist. And this is a good thing in many ways. You actually want to have that coordination of care with your primary care doctor. And you want to also see what the primary care doctor recommends and which cardiologist they may recommend you see. On a PPO plan, you still have the same opportunities. You could still go see your primary care doctor. And again, I strongly recommend getting that guidance from your primary care doctor. Or you could say, I want to go see that cardiologist, and just pick up the phone and call them or schedule online.
And how do you choose a doctor who is right for you? What things should you be considering when choosing a primary care physician or a specialist, like a heart doctor, a diabetes doctor, a cancer doctor, orthopedic doctor?
Picking a physician is very personal. Ultimately, you're inviting that person into your life. When you're in the exam room, you're telling them your story, you're telling them what you're thinking about. And it's a very personal decision. And it's hard because people say, well, how do I pick a primary care doctor? Do I go on the web? Do I look the person up? And the answer is yes, you can do that. We have a phenomenal website that talks a lot about the primary care doctor, talks about their interests, their patient satisfaction scores, a lot of information available on the web. Oftentimes people also use word of mouth. They ask their neighbor, they ask their trusted friend, who do you recommend? As I mentioned earlier, we have 1-800-SCRIPPS. These are trained professionals here to make sure that they can help guide you to the type of physician that works well with you. Once you have that healthy, strong relationship with the primary care doctor, and that primary care doctor gets to know you, it becomes a lot easier for them to say, okay, you know what, I think you really would do well with this pulmonologist or this allergist. And so then you have a much better connection with understanding which specialist works well for you.
And should you also consider whether that doctor is part of a large practice or a small office, where the location of the office is? If you need hospital care, does your doctor have privileges at those Scripps hospitals?
So understanding a little bit more about which hospitals your physician goes to is important. For example, I know many people who, when they pick an OB doctor and they're looking to have a child in the future, they oftentimes also know where they want to deliver their baby. So thinking in advance and understanding, does that OB physician you pick, do they go to the hospital that you want to deliver at? Now, we have phenomenal hospitals that do deliveries amongst almost all of our hospitals. And it'll be important for you to understand which hospital works best for you. But oftentimes, once you are a patient with a Scripps physician, then really as a system, we're here to support and serve you. So whether you need to be hospitalized in one hospital versus another, we have the flexibility and ability to kind of make sure we take care of your needs to where we provide the best expertise. Again, when you look at where you want to have your primary care, oftentimes people want to have it closer to home or near their community. But nowadays, people also want to pick somebody that might be closer to work. And we have an ability to have locations all over. And one of the nice things we've implemented this year is the Scripps Health Express. So even if you have a primary care doctor in your home community, but you're at work, we oftentimes have a Scripps Health Express center located near you or an urgent care center to help meet your needs, even if you're away from your home.
And staying within your healthcare system for all of your needs isn't just convenient, right? It's also critical when you're faced with the unexpected. So, for example, the Scripps primary care doctors have immediate access to all of your comprehensive health profile through the MyScripps app. That's that patient portal, that's myscripps.org, which is this electronic health system, medical system that all of your information is stored in.
Yeah, so having the MyScripps app is probably one of the best things you can do, both for your health, but also because you want to have access to your information. I mean, how many times have you gone to the doctor's office, you walk in, you sort of leave the office and you say, what was that medicine they told me to take? What was my glucose level? Right? What was my blood sugar? And all these questions sort of come in mind. I think when people leave the office, they forget a lot of what happened in the office. The nice thing is, through the Scripps app, the MyScripps app, you can actually go right onto your iPhone, your iPad, or your computer and be able to look and see some of the lab tests, some of the notes, some of the results, the upcoming appointments, when you had your vaccines. There's a lot of functionality built into that app. The other thing that you mentioned, Susan, is a great question, is about the ability of having all your medical records into one system. And at Scripps Health, we have a medical record system. It's called Epic, but it's a medical record system that many of the leading organizations across the country utilize. And this is great because we have this information all together. So when you go to a Scripps Health Express, an urgent care, a specialist, a primary care doctor, they all can access that information. And the other nice thing, because it's such a leading medical record, that oftentimes if you are out of the area and a health system out of the area is also on Epic, which is quite common nowadays, that you can allow your information to be shared even externally if you unfortunately have an emergency or an urgent issue externally. So this is probably one of our most amazing attributes of Scripps Health, is that this electronic medical record really brings this information together, tracks and trends it, and then shares it back with you.
So to sum things up, any final thoughts, Doctor?
So to sum things up, I think the most important thing is that we are here to serve you. We are excited with the privilege of being able to see you at Scripps Health. As open enrollment comes around, please do call 1-800-SCRIPPS. Reach out to any of us. We would love to make sure that we find the right plan for you and the right doctor, because we're ultimately here to serve you.
Dr. Keswani, thanks so much for taking the time to be with us. We really appreciate it.
Thank you, Susan.
Open enrollment, as you have heard during this conversation, can be very complicated, and we are here to help. So once again, if you need to speak to somebody about open enrollment, it's very easy. Just call 1-800-SCRIPPS. If you'd like more information on open enrollment, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. For more than 100 years, Scripps has been here for San Diego with primary care doctors and specialists who put our patients front and center of everything we do. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.